Hello, everyone. My name is Amy Radion, and I'm the social worker at the University of Maryland Women's Health Center in Baltimore, Maryland. It is my pleasure today to walk you through the electronic PRA process. I have been the social worker at the University of Maryland Women's Health Center for the past 13 years. So I have seen the evolution of the paper PRA into the electronic PRA. And I cannot tell you how fantastic this has been, from paper chasing to who did it, who didn't do it, to now just being able to do click, click, click in the chart and be done. This is a very exciting process and time to be in with the electronic PRA. And so I'm going to walk you through how we uniquely do it here at the University of Maryland. We have our electronic medical record system is EPIC. So everything that I talk about today and what I'm going to show you here in a little bit is how we do it through EPIC. So to talk a little bit about the process in our office, patients have the PRA completed at their first visit in our office, and that can happen in two different ways. The first way is patients who are under 14 weeks gestation have what we call a nurse education visit. During that nurse education visit, the nurse completes the patient's history, orders their initial labs, and does all their consents. And that is also the first time that the PRA will be completed. The second way the PRA gets completed is if a patient comes through our office and their very first visit is actually with one of our providers, one of our physicians, or one of our midwives. That's where I come into play to complete the PRA. So what happens is the patient will come in, the patient will be seen by the provider, and then I will come in and complete the PRA. If I'm not available or I'm off that day, the backup plan is that one of our medical assistants completes it. And you'll see here in a few minutes how this process works very smoothly through the electronic system, because now we are no longer chasing the papers to see, was it done, was it not done? It doesn't get lost with all the other consent forms that our patients has to complete. So now I'm going to walk you through a patient example. So please meet Pansy OB Zanzibam. Please know that this patient was completely made up by my IT department. There is no HIPAA violation happening today. They were very gracious to give me this patient, and we inputted all the information. So as you can see in the OB chart, under OB tools is where you find the electronic PRA. So prior to me coming in the room and meeting with the patient, the provider has completed most of this information. The key thing I want to note here for anybody who's using EPIC, this episode of care has to be created in order to generate the PRA. So that is one thing that I was concerned that we would have issue with. It's only happened a couple of times. I had to run back to the resident and say, hey, can you create the episode? But that's a key factor in EPIC, that this episode has to be created. So you click on the ePRA and you're going to immediately notice that there's only very few sections that we have to complete. The demographic information, sorry about that, my computer, I scrolled too far. The demographic information that we used to have to write in by hand, all of that stuff will automatically be generated when we generate the letter. So we no longer have to enter any demographic information except for these few things. So we're going to check she's unmarried, she's graduated high school, and we only check positives now. We don't check the no answer. So there's only things you check that are positive. And no, she's not a transfer of care. She's in her first trimester for her visit with us today. Any of these things that you know, we know that she has, this is not her first pregnancy, so we're not going to check that. She also has not had any of these other OB history concerns that are in here. The G's and P's automatically populates where we used to have to put that in there. It is now done based off of the note of the provider. As you can see, this is already grayed out for us because the system already knows that this patient is under 20 weeks gestation. So we're going to say that, yes, this is an unintended pregnancy. We're going to say that, yes, this patient has illegal substance use. And then what we're going to do is we're going to go down here where it says other comments. We're going to say this patient has a history of marijuana use. So where you were able to also free text in the paper, you can now free text in EPIC and type things. We're also going to say she has lack of transportation. And then we're going to scroll down to the medical risks. As you can see, some of these things are already filled out for us because the histories are even completed by the provider. Now, this patient with her diabetes, we can see by her medications that no, she is not insulin dependent. So we can go ahead and check that. Then it's going to ask, we always complete depression screens on every patient. So we're going to check yes. And then if we knew of any other risk factors, we could input it here. So you can see over here, like on the problem list, things that I always include are things like if we know the baby has a known problem. So I would check yes and type in fetal cardiac anomaly or whatever would be going on with the baby. And then all you have to do is click to sign. And as you can see, this is how I'm signed in as this test A and B resident. It would put my name in there as the person who did it, and I hit close. And now the PRA is completed. And you can see a preview of the PRA of what's for the patient, right? And you can see how all of this information is included. Now the payer information will show up here again, because we are in a test environment. Some things are not going to come through. So you can see all of the things that we entered are here. You can see the OB history, which we did not do, is auto-populated. The patient's due date is auto-populated. All of these things are pulling automatically from Epic. And so now that we've done our part for completing the PRA, now I'm going to show you how our front desk staff sends the letter out. The other thing I want to share with you is that when I complete the PRAs with the patients, I make them aware of what we are doing. I let them know that we complete this assessment for a couple of reasons. One being, it lets their insurance company know that they're receiving care in our office. And the second reason being is that it automatically generates a referral to a program called Healthcare Access Maryland. I let them know that Healthcare Access Maryland reaches out to them based on where they live. If they live in the city, it'll be the city. If they live in Anne Arundel County, it'll be Anne Arundel County. And they can connect them to support programs in the community that are very beneficial with them throughout pregnancy. I like to let the patients know this simply because they're going to get a lot of phone calls, and I want to make sure that they're aware that when the individuals are calling from Healthcare Access Maryland, that this could be a vital connection to programs that are very helpful to them throughout their pregnancy. So now we're going to go and we're going to send the letter. All right. I'm going to show you how we send out the letters via Epic. These letters are completed by a designated front desk staff person in our office, who at the end of the day goes through and sees who all of our new patients were and will go in and generate a letter. Again, what you're seeing on my screen, there are no patient information. You're just seeing the names of providers within our department. So what they do is they go up to Epic and they send a letter. We go and we pick our patient, and the provider that we put in is the attending of the day, because this automatically generates that information at the top of the paper PRA that has the NPI number and the other required information. So we're going to use Katrina Mark, who is one of our attendings, and we're going to go to new, and then we go to payer communication tools. In payer communication, we're going to add a recipient. So we built in-house in our system every jurisdiction and every insurance company for us to be able to send it. So all I have to do is type in PRA, and you can see right here, here is the Anne Arundel County AACU, the administrative care coordination units that are used in the counties. Baltimore City is the one who uses Healthcare Access Maryland to contact patients. So all we have to do is we would just click the jurisdiction where the patient lives. Now, how do we know the jurisdiction where the patient lives? So then we go to snapshot for the patient, and we click on the patient information, and we see that she is in Baltimore City. So now that we know that our patient is from Baltimore City, we hit add recipient, and we type in PRA, and we find Baltimore City. There's Baltimore City. We hit accept. And then up here, the document we want to build is the prenatal risk assessment. And we have that. And then we can also send it to the patient's insurance company. So we see that this patient has a merit group. So we're going to do PRA again, and we will take a merit group and we hit accept. So to build these lists in Epic, our Epic IT team, we gave them a list of all of the jurisdictions and all of the fax numbers. And same thing for the insurance companies. The one lesson that we learned from this is that within Epic, there is a way to go to make sure there's called a fax work queue, which you would have to figure out with your individual IT departments. That's how we discovered that a couple of these were not going through and there were updated numbers. So one of the things that we have learned is to periodically be checking in to make sure there has been no changes in the fax number for each of these things. So then you would just hit fax and it would go. So to be on the safe side, to make sure this does not fax these individuals, I'm going to go in and just change this to my fax number here in the office, just in case, even though we are in the test environment, it should not send, it shouldn't go. So that's going to be the new fax number. So this way I can show you what it looks like so you know that the form was faxed. So if we hit send, you can see that it is sending the fax. Oh, and it actually did work because I'm getting a printout that it came. So good thing I changed that fax number. So now you can see that this has been sent. So that's my walkthrough of how to do an electronic PRA, from the beginning of how we complete it to how we send it. I cannot speak highly enough of how much this was welcomed by our office and how we were very excited to be able to do this. All of us who have worked here, myself, the MAs, the nurses, the staff, have all been through the paper PRA. And just to be able to have an electronic version, it's allowed us to ensure that the papers don't get lost. It has allowed us a quick, easy way to do it, that we no longer have to fill out the entire form. We only have to do pieces of the form. The recommendation that I have for you is, in your particular office, is to come up with what works for your office. What has worked for us is that the nurse is completed at that nurse visit. When the patients come in to see the provider for the first time and haven't had a nurse visit, it's worked for me to do it, because as the social worker in the office, one of my jobs is to touch base with all of the pregnant patients. And also our MAs know how to do it. And they are so thrilled now that if they have to cover for me and do it, that it's so easy to complete it. And if you don't have time to do it right there with the patient, you can go right back in very easily at any moment of the day and complete them. It allows the front desk staff to have a better way of tracking it. We designated a front desk staff person who also has a backup. I truly believe everybody's got to have a backup that can now do the letters through the system. It has saved them time, because they don't have to run around and track everybody down to see what's been completed, what's not been completed. They can already see it. They can easily see who's been arrived and who needs it completed. They can track if they've actually been sent. And I think the other thing that's very beneficial to, not only the insurance companies, but Healthcare Access Maryland and the administrative care coordination units, is now you can read it. There's no longer, can I decipher the handwriting? Is this a 2 or a 0 or what these numbers are? That everything is now very clearly typed out and written. And the other benefit is for the patient. The services that are provided in each jurisdiction are vital to the patients, not only the patient's health, but their unborn child's health. I highly recommend that you figure out how to make this work. It's been a lifesaver to us and such a time-saving instrument. I greatly appreciate the ability to talk to all of you about the benefits of this electronic PRA, not only for completing it, but for what it does for the patient. As I said earlier, this process is so much more smoother than using the paper. It's so much more smooth, and I cannot speak highly enough about it, and highly recommend that everybody do it. It has been my pleasure today to walk you through this. And I wish you all luck on venturing into the world of ePRAs.